allergy on my ACL, and I really need to pay it off.
Well, I'm feeling lucky.
Oh, okay, good.
Yeah, well, good, because you have the last one.
Oh,
Good. I hope you win.
thank you.
Oh, man.
Well, what do we have here? Oh, well, it looks like this person lost the lottery. Oh, wait. They didn't knock one of them out. Alright, I guess I'll scratch them off with these keys. $500? Hi there. My name's Rodney Anderson, and I've got a lottery ticket here I scratched off for $500.
No, I'm not going to take that, sir. I'm really sorry. Your hand's very red and very swollen, and there's abscesses on it, and they're pussing.
Oh, it looks fine to me. It's
no.
not very bad.
It's very bad. I'm not touching that.
I don't see any redness at all.
Sir, your whole hand is red.
I can't see that. I'm colorblind.
You should go to a doctor.
Okay, we have the results of your testing, and we did 3 different tests just to make sure that we had the right specimen. We took your pus sample and we cultured it on a blood agar, and we found golden colonies that were positive for beta hemolysis, which showed us that you had Staphylococcus aureus. Then we checked it by growing it on mannitol salt agar, and it was a positive result due to the yellow around the colonies because it can ferment mannitol. And then we did a coagulase test where we mixed your sample with plasma, and it was positive for clotting, so we knew that you had Staphylococcus aureus.
Oh, I learned about Staphylococcus aureus in my med-micro class. Isn't it a gram-positive Staphylococcus?
It is a gram-positive Staphylococcus.
Oh, okay, so it's also a coagulase positive, is that right?
That's right.
Oh, wow, okay, so I guess maybe I should teach a med-micro class if I'm this smart, huh?
You might want to.
Well, I'll think about that.
Usually this pathogen is going to be transmitted during surgical procedures, so you would have a contaminated fomite or a contact of the contaminated skin by another skin that's contaminated, but you can also get it from any break in the skin or contact with an object that is infected by Staphylococcus aureus, and usually your skin is an adequate barrier, but not always, because it's broken during the procedures.
Well, I didn't have any surgeries anytime lately, but I did pick up a lottery ticket the other day, and that's when I started to, lately I've been starting to feel worse and getting the red pus on my hands. Ever since then, I came up with some problems.
Okay, so the way this bacteria works is it's going to enter in your hair follicles or through a break in your skin. It's then going to attach to the plasma proteins and other components of the extracellular matrix. And it's going to avoid your host defenses by producing protein A, and it also can combine to antibodies so that so it's not targeted by your immune system. And some do have anti-phagocytic capsules, which also helps them to prevent from being destroyed. Then the pathogen damages your body by using its 5 enzymes, and it also has 6 types of toxins. Then it can exit through pus or discharge of the surgical infection area.
Wow, that's some really in-depth information. I'm glad that my med-micro professor doesn't test us on that. Testing someone on that kind of stuff is just inhumane.
I agree. So what I'm going to give you for your treatment is going to be a prescription for rifampin. It's going to be 600 milligrams once a day, and you're going to take that for 28 days. You also are going to take it in combination with another anti-staphylococcal antibiotic to avoid resistance. And if you have any trouble with fever or pain, you can take ibuprofen. We also recommend that you get lots of rest and maintain your fluids and electrolytes. Any questions so far?
None for me.
And so to prevent this from happening again, you want to make sure that you wash your hands and use good hygiene. You want to not share personal care items like razors or towels. You want to avoid contact with anybody that you know is infected with it. And the most important part of preventing Staphylococcus aureus is to always use aseptic technique during invasive surgical procedures and to always use universal precautions.
Okay, well, thank you very much. I just have one question for you.
And what's that?
Do you think I would look good with a mustache?
Yes, I do.
Okay, what about any other fashion suggestions for me?
You'd probably look pretty good in a flannel.
I don't know if I'll ever wear flannels.
You should try it.
Okay, well, thank you very much for your help, doctor.
You're welcome.
Hi there, Rodney Anderson back. This is me, and I have the Staphylococcus aureus on my hand.
It's all gone?
Earlier, it's all gone. I was on antibiotics for 28 days.
Wow.
And it's all better now. I'm ready to cash in my $500 check.
All right, let's see if you won. I'm really sorry, but it's expired. You took too long to bring it back to us.
Is there anything else you can do for me?
Actually, I think there is.
What is that?
We can give you a lifetime supply of Diet Dr. Pepper.
Well, I guess I can take it.